Hi, good morning. This is Edward Ng with the Pittsburgh Foundation. Welcome to this morning's Westmoreland County COVID-19 response call. Just a couple housekeeping items. There is a handout for this session. If you scroll to the bottom of your control box, you'll see a training flyer, 4.7.21. Go ahead and download that for yourself. This session is, of course, being recorded, so you can view it at a later time. And please hold your questions into the chat, or put your questions into the chat box, and we will answer them all after the webinar. I think that's about it. So that said, I'm going to hand it over to Phil Koch.
Hey, thanks so much, Edward. I appreciate it. My name is Phil Koch with the Pittsburgh Foundation and the Community Foundation of Westmoreland County. Glad that everyone's here once again so that we can talk about the ways in which we're responding to the pandemic in Westmoreland County and the way that we're serving our most vulnerable populations. I also want to take a moment to thank all of our panelists today. We've got a great group of panelists. Once again, I'm here with our partners at the United Way, with Alyssa Trolowski, as well as Stella Stanger from the Westmoreland County Behavioral Health and Developmental Services. Today, we're going to hear from Dr. Carol Fox from Extella Health. We're excited to have two of our commissioners with us today, Commissioner Doug Chu and Commissioner Gina Sorelli. We'll also hear from Bud Mertz, from the Director of Public Safety. One of a newer panelist that we haven't heard from and we're excited to have with us is Raji Jayakrishna from the Community Health Clinic. We'll also hear from Jennifer Miller from the Food Bank, Deb Thakura from Feeding the Spirit, Dan Carney from Union Mission, and then Jesse Spraykar from the United Way, the Community Impact Director. I want to also take a moment to thank the Westmoreland Museum of American Art for providing the artwork that was on our title page today. That is an oil painting on canvas by George Ines, and again resides at the Westmoreland Museum of American Art. The painting is called The Coming Shower, and in that painting, Ines captures the light effects produced by rapidly changing weather conditions. The dramatic scene is charged with the storm's energy, foreground trees cast into bright light against the darkness of the forested hills behind. And the viewer cannot help but to feel the thrilling yet dangerous sensation of being in the midst of such a storm. So, thank you once again to the Westmoreland Museum of American Art for that amazing painting and for allowing me to sound like an art broadcaster or something crazy. So without further ado, we're going to get started. I do know that Dr. Fox needs to run to a statewide meeting, and so we want to get her in and out as quickly as possible, and then we'll resume our regular schedule. So Dr. Fox, over to you, and then we'll come back to hear announcements from the Community Foundation and the United Way. Dr. Fox.
Thanks, Phil, and good morning, everyone. It's great to be with you again. As you know, cases are certainly on the rise. The positivity rate for testing that we have done at Extella for the month of April is about 15% positive rate, and that's much higher than it had been in February and early March. Our inpatient cases have doubled over the past week. However, I am happy to say that our ventilatory capacity is stable, as is our testing capacity. We are doing all of our testing currently in-house so that we do have a more rapid turnaround time. Our Fry Farm Road site remains open for testing as well as for face-to-face evaluations, and we are delivering monoclonal antibody infusions at our Frick Hospital campus. Monoclonal antibodies are a treatment that's designed to prevent hospitalizations for our most vulnerable, and in particular, those who are elderly, obese, or those with comorbid conditions. It has to be given within 10 days of illness onset, but it has been very effective at preventing more serious illness for individuals who qualify. We continue to participate in the RCAP program, which serves skilled nursing facilities and personal care homes. We're doing so in collaboration with both UPMC and the Allegheny Health Network. And there have been recently, unfortunately, outbreaks in several of our local facilities. So we are continuing to work with them on their PPE supplies and on their outbreak responses. So while we're certainly focusing on those who are ill, much of our current efforts really are related to vaccine distribution. We have delivered or scheduled over 43,000 shots to date, And this represents nearly 30,000 unique individuals in our county. We are currently administering our vaccines at the former Galaxy Fitness Center in the Norwood Medical Commons. And we're currently using the Moderna vaccine, which has been approved for individuals over the age of 18. We are working to schedule some special sessions for certain groups outside of that Galaxy site, so more to come on that. We do have a registry, so individuals can go to www.excelahealth.org, or they can call 724-689-1690, Monday through Friday from 8 to 4 to schedule a vaccination. Once you register, you'll be, put on a list, and as appointments become available, they will be pushed out to you. The current turnaround time is very quick, so I would encourage you and any individuals who are looking for a vaccine to go ahead and register, and when it's your turn, based on the state recommendations, you will be given an appointment. We're also continuing our work with 211 and the Area Agency on Aging, Laurel Faith in Action, Meals on Wheels, Open Your Heart to a Senior, and VOW to help schedule some of our most vulnerable individuals. And the thing that we're working on this week, again, we're working with Director Mertz, with Chris Tantlinger from Emergency Management, with our EMS partners, as well as with the United Way and Excella Health Home Care and Hospice to develop a mobile vaccination program so that we can go out and actually get to individuals who are homebound. So we hope to have our plans in place more clearly actually by tomorrow so that we can start that process. So we've been pretty busy, but things are going well for us, but I would encourage those who are listening not to let your foot off the gas. Continue to wear your mask, continue to social distance. We really need to get a critical mass of individuals vaccinated and get the current surge under control before we can feel more comfortable. So thank you again for having me, and hope to talk to you again next time.
Thank you, Dr. Fox. I appreciate you jumping on, even though you're double booked today. So thank you.
Sure.
I'm going to move on over to Alyssa Chodorowski with the United Way, who will bring us some information, I believe, about probably a little bit about 211, I would guess, and maybe a little bit about the Human Services Study.
Yes, good morning, Phil and everyone. Another beautiful day here in Westmoreland County, and happy to have everyone on the call. 211 continues to be very busy. I checked the stats this morning, and in the last 30 days, specifically for Westmoreland County, there were over 1,400 calls, and then we have chats and texts that go over and above that. So that's a lot more than last year. There's about 200 more calls this year in that month than last year. So things continue to be on the upswing. Looking at where people are calling for information, it's not surprising. 38% are looking for the COVID vaccine, information about testing, information about symptoms and treatment, and those kind of questions. So that continues to be one of the major things that the 211 resource navigators are answering. Also, people are concerned about housing and shelter. 28% of the calls are around that. 85% of those calls are asking for rent assistance. So we know there's a lot of people who continue to struggle, and I know help is on the way in some cases for that. So hopefully more to come on that. And I think some of the people on the call, Dan in particular from Union Mission, will be talking about what's happening with that. And then we continue to see people asking for utility assistance, help with payments. People have gotten some shut-off notices, and we continue to help with that through 211 and some emergency basic needs grants that individuals can receive. The news on the Human Services Study, we are days away from publicly putting out the study. We have presented it to the Board of Commissioners earlier this month, and then we will be presenting it tonight to our United Way Local Operating Board. We had an opportunity to present it to the Community Foundation of Westmoreland County's board about a month ago. We're anticipating it will be released publicly on Monday. The main recommendations are around the integration of human services within the county. itself, and then with the provider network, to be able to serve more people, to get out within the various stretches of our county. As we all know, we have some very rural places where it's hard to reach people, and people cannot necessarily always get out with transportation. That always comes up as one of the major needs in the county. So the next step will be to set some action plans around the recommendation. We've already had some ideas and thoughts bubbling up around that. We want to make sure that this study isn't just something that goes on a shelf, but that has a life of its own, and we continue to see work done around it. I think it's pointed out some really important work that we can be doing. I just want to say thank you. I know so many people were involved in that. Phil, thanks so much for being there by my side through this program. We had the Hill Group was our consulting group, just an amazing work that they did, and also the support we received from the commissioners who have read it with an open mind and given their thoughts back on how this can be worked out in our county. And so I think we really have something to guide us going forward on the human services study. So always happy to answer any questions about that. Hopefully it'll be out in its full form, which is 50 plus pages. So get your reading glasses out and can take a look at it. As Dr. Fox said, we are continuing our work with vaccine scheduling with our partners at Area Agency on Aging, Open Your Heart to a Senior, and Laurel Faith in Action. I think we've scheduled over 600 people now. These are frail older adults, most of them needing transportation help. So we were fortunate to have many people step up as volunteers to drive our older adults there, people who otherwise probably wouldn't have been able to get scheduled because they didn't have the technology, they didn't have many times a neighbor or a friend who could get the appointment for them. So it's just a super good feeling, and we're just thankful that Excella kind of gave us access to their system, and that we've all been working really closely together, and with the public safety who's going to help us with our homebound residents, and the commissioners who've also been supportive of this effort. So thank you all around. And that's what I have. Jesse from my team will be talking later on about another special initiative we have going for the summer. So more news to come from United Way. Thank you.
Thanks, Alyssa. I appreciate it. Let's move on to Sarah Stanger, the administrator with the Westmoreland County Behavioral Health and Developmental Services. And Sarah, just a note that the handout that you wanted to distribute is in the handout section of the WebEx, so people can download. Sarah?
Hi, yes, good morning, everyone. We did want to update our training provider, our training list that we provided last month. We have more of the links available on there, and the registration information. We continue to try to add different trainings, some for the community, some for consumers, and then some for practitioners. Several of these have free CEUs attached to them. We wanted to try to focus on that to make sure everybody was getting their credits that they need for social work. And there also is several areas of self-care, dealing with anxieties, different subject matters. So whatever you're interested in, all of these trainings are being provided free, and almost all of them are on Zoom. There are trainings for mental health first aid and youth mental health first aid that also has a certification piece to it. Again, all these information is attached on the flyer. The only other area I wanted to talk about today was we have received approval from the state in partnership with them for forensic funding to offer for any of the forensic population out in the community to help with housing. It's person-centered to make sure that these individuals are able to live in the community successfully. This program is being funded through WICSE, the base service unit for the county for mental health diagnoses. So if you know of anybody that needs this funding piece, we are just now starting to get information out to the public on it, but we did get a nice pot of money to be able to help these individuals to be successful on their own. Also, I forgot to mention on the bottom of the training flyer, there are a couple events coming out into the community, the CSA Paws for Prevention Dog Walk, and some of the consumers in the community are putting out a mental wellness and recovery community fair on May 22nd. So there are a couple events listed on this flyer also. But if anybody does need anything, is hearing anything that we need to address, please just continue to reach out to me. Thank you.
Wonderful. Thank you so much, Sarah. I appreciate it. We are honored today to have our two of our commissioners with us, Commissioner Doug Chu and Commissioner Gina Sorelli. So glad they're with us today. Commissioners, I put you on the sort of same slide because I know that you had sent me a slide to share with folks. So Commissioner Chu, I'll send it to you first, but certainly if you want to talk together, however you all want to do it, I'll pass it your way. And Edward, if you could forward just one more slide to the slide that they had shared with us.
Thanks, Phil, and thanks everybody for joining the call. These are really great to keep everybody informed, and it's always exciting to see how many people join every week. So Commissioner Sorelli Thrasher and I will split up some of the county stuff today. There is a child care grant program that has opened up. There's about $300 million in that program. It is not being run by the county, but in talking to some child care providers recently, there hasn't been a lot of information that they've received on it, so I wanted to bring that up today. There is a small form that is needed. It is found at that link under info here, which I think Phil and his team will send out after the presentation this morning.
Commissioner, they can actually, right now in the chat section, they can access those links if they would like. We've loaded them into the chat section.
Perfect. The application is very simple. It's very short. We looked at it in our offices last week. And the formula is set by the state in terms of how much money will go to each child care provider and organization. So there's no real accounting or paperwork that needs to be done. It's all a matter of completing a form, and the amount of money sent to you is based upon the algorithm established already by the Human Services Department. I think both Commissioner Sorelli Thrasher and I will talk a little bit about that ARP funds that are coming. The county itself is getting about $107 million. There'll be some similar restrictions to CARES funding. In other words, some of that money will have to be dedicated towards losses due to COVID or to helping the COVID pandemic. But there is a unique category in this amount of funding that allows for infrastructure upgrades for sewage, which I clearly couldn't spell correctly last night at 9 o'clock, water, and broadband. So not other utilities, but the big three: sewage, water, and broadband. And I know there's been some talk about how we'll move forward with that going forward. Municipalities get their own pot, but I also want to say that there is a phenomenal amount of money in that bill that is coming to a variety of different agencies, whether it's transportation, certain types of infrastructure. It won't all be centered in the county or the municipalities. There will be a variety of programs that will be set up by the state and the federal government in response to that. I think both of us will say a few words about your voter profile. Now is the time to check your voter profile. Now is the time for everybody to make sure that they have their right address, they're registered correctly for the party that they prefer to vote in, etc. If you need to make changes, either of our offices can help you through that paperwork. It's online as well as on paper. But now would be the time to check that and not wait till May 13th, whenever the deadline pops up. I'll just say that Dan Carney will probably talk about some of the rental assistance coming up. that Alyssa mentioned is in great need. There's rental and utility assistance that should be opening on April 15th. And then I'll turn this over now to Commissioner Sorelli Thrasher.
Thank you. Good morning, everyone. I just
Morning.
want to speak briefly. Thank you, Doug, for everything that you just said. I just want to say thank you so much to all of our providers. Once again, you guys have been rock stars. Lots of long hours, but come July, you guys can sleep then before we have to do the second round of vaccines. But I just want to say thank you so much to Dr. Fox at Excella and Alyssa. Thank you so much for helping to be able to get our senior citizens signed up to get the appointments that they desperately needed. And like Alyssa mentioned, Dr. Fox, our next priority now is homebound individuals. So luckily at this point, all the seniors were able, hopefully, to get appointments to get vaccinated. And now we're going to be moving on to getting the homebound individuals vaccinated as well. Exciting news that we're going to have a couple more vaccines to add to our providers that we already have. Walmart is going to be doing a Pfizer vaccine, and I like to thank Bud Mertz and Public Safety for organizing that. We're going to have it at Seton Hill, and it's 3 dates in April, and Bud can give you those dates. I apologize, I don't have them in front of me. And a huge thank you to the Transit Authority, who's going to be providing transportation, a shuttle bus for those that are going to Seton Hill University on those days. Like we said last month, it takes an entire village of everybody coming together. So thank you to all the partners that are pitching in for this. Walmart is also going to be getting a large shipment of Johnson & Johnson vaccines. So they will be working with Public Safety to form additional vaccine clinics, hopefully in our underserved areas like New Kensington, Jeanette, Menneson, areas like that. So again, thank you to everyone. As Commissioner Chu mentioned, now is the time to check your voter registration. So please go online to do that. Thanks to Commissioner Chu, I checked mine as well, and to make sure that I did sign up for mail-in ballots. So you have until May 3rd to register to vote, and I believe it's May 11th to ask for a mail-in ballot. But don't hesitate, don't wait like we saw in 2020. Get it done as soon as possible. Thank you, everybody.
Awesome. Thank you, Commissioner Chu. Thank you, Commissioner Sorelli Thrasher. Really appreciate the partnership, especially on the human services study and the work following that, but also for all the work that you've been doing around vaccines and staying on top of all of the federal funds and state funds that are available, county funds. So really, once again, really appreciate that. We've heard from a couple folks that they were having some trouble accessing the links in the chat. So we'll go ahead and also include those links in the follow-up email that comes in the day following this call. So I'll make sure that that's there as well. So I'd like to go ahead and move on to Bud Mertz with Public Safety, our Director of Public Safety. Bud, what do you got for us today?
Well, first, I got to thank you for that artwork, opening artwork, because it gives me a great opportunity to promote preparedness as we enter into the spring season. We all know that spring season brings thunderstorms and tornadoes. Westmoreland County leads of all the counties in Pennsylvania, the most tornadoes, tornadic activity, since they've been keeping records. So it sounds crazy, but so yeah, the coming shower artwork allows me to remind everybody about being prepared. You got to understand that when a storm hits, your first responder community is usually sent out into 18 different directions at one time, for trees, wires down, flooding, and all kinds of other stuff. So it's very important for our public to be prepared. The website ready.pa.gov is an excellent tool that the people can use to be prepared, to build a preparedness plan. It enforces how to be informed so that you know when bad weather's either forecasted or approaching, how to be prepared to develop a home plan for you and your family, and then to be involved. And being involved could simply be just making sure that your other ones, your loved ones, those that are having more difficult, also have a plan, and you act as a family or a unit to remain safe going through there. So thank you for that. I'll jump into the our COVID vaccination because we have really a lot going on. I believe that we sent in the flyer that we have a vaccination clinic in partnership with Walmart coming up. The dates are actually this Friday, as well as the following Tuesday. So Friday, the April 9th, Tuesday, the 13th, and Wednesday, the 14th. This is not a online registry. This is a dial-in registry where you're dealing with the Pennsylvania call center, 1-800-753-8827, and you select option 1 in order to register. So you don't have to register online. We've developed flyers for this. We spent a good portion of this week handing out those flyers to our different social groups so that they can put it in with the food bank and some of the other ones that so that we can hand it out. They can hand it out during those deliveries. But it is open to everybody. Obviously, we are targeting the underserved or those that have the most difficulties in making appointments. So it was a great partnership with Walmart to bring them in. We're looking at close to 1,400 vaccines through this first session here. So and many more come in. Also, additional. I received word last night that the state is setting up a regional vaccination center, and this regional vaccination center is in partnership. The first line is with Allegheny Health Network, and then the second line is going to be with UPMC. But they're looking at a mass vaccination center of a throughput of 6,000 a day of the Johnson & Johnson. Now, I only have the information of what is coming up with them, with the Johnson & Johnson, and that is also this Friday at the Northern Tier Connect at Pittsburgh East, which is 4350 Northern Pike. And there is, I believe, an online registration. So when I get more of that information, I'll be glad to forward that as well. And maybe it can go out tomorrow. So a lot of great opportunities that we have to get vaccine into Westmoreland County. We're taking advantage of every possibility. We continue our work with Excella Health, them being the most consistent vaccination center that we have with the numbers that they're getting in, as well as the partnership with United Way and the grassroots social service to get those registered. And as mentioned, we're working with the Homebound initiative. The Homebound initiative is just a little bit more tricky because you're going out to houses. The timing has to be right. I think I mentioned the last thing at the last meeting that the timing has to be right because you crack open a vial, you administer it, and you have 6 hours to actually use everything in that vial of vaccine. Before it goes bad. So we have to make in between transportation, doing the pre-screening, the inoculation, the observation afterwards, we have to try to make sure that we do the best that we possibly can to use everything, all the vaccine that once it's open, and do it in a timely manner. So it's a little bit more difficult. We're using our GIS services here in order trying to map those best routes out. And we're going to finish our planning meeting with Excella Friday, and hopefully we come out with a solid plan on how we can accomplish that. So a lot going on. I'd like to say that according to the state data, we are at 68.2% in our vaccination of at least one dose to the senior citizens 65 or older. So I think that that's a good number as well. That's all I have. We'll send additional information for posting to the group and moving forward. Thank you.
Sounds great. Sounds great. Thanks, Bud. And I'll make sure I reach out to you next month so we can coordinate the artwork with your announcements. So Glad that worked out. We're going to move on to Raji Jayakrishnan, who's with us from the Community Health Clinic. So really glad you're with us to talk a little bit about the work that you all are doing.
Good morning, everyone. I work for Community Health Clinic, a federally qualified health center. I'm new to this group here. And what we do is we offer medical, dental, and behavioral health care in the underserved communities. So since the pandemic hit us, we have been actively working with offering testing, both at the Greensburg and New Kensington location. And now we've pivoted to offering vaccines at both locations. And we have 3 sites to start with: Greensburg, New Kensington, and Vandergrift. So of late, we have been invited by HRSA to sign up for vaccine distribution. So this is bypassing the state distribution system. And HRSA offers a choice of vaccine: Moderna, Pfizer, or Janssen. And we plan on securing some Janssen vaccines for our hard-to-get patients. And what we have observed in the last couple of days is that there's a decline in the number of people coming forward to get a vaccine shot. I'm not sure if it is saturated or if it's vaccine hesitancy that's playing in here. And in addition, we have a special call from the governor's office to reach out to the homeless population living in shelters. Actually, Governor Wolf's goal is to get them immunized before April 19th, before it's open to the general public. And we have not been, at least I have not been seeing any responses forthcoming from that population, even though we're talking to shelters, etc. There's not been a steep interest. I'm not sure where they are exactly. And as Dr. Fox pointed out, we are beginning to see an uptick in testing requirements, demand for testing, which is not a good sign. And that's about it. So we'll work with anybody who is willing to work with us on getting as many people immunized as possible. With the federal shipment, we can expect a steady shipment week after week, and we get what we ask for. However, we have to expend whatever we have within 80% of it should be expended within 7 days. So that rule does not change. And I do not want to hoard any vaccines, if there's no demand. So if you think there are people out there who do not have a vaccine yet, please connect them to us, and we'll make sure they get that. The 2 sites that are offering vaccines right now are New Kensington and Greensburg. And as of in a week's time, we will have some vaccine going out to our Vandergrift location also. Thank you.
Wonderful. Thank you so much. I appreciate that. And just to reiterate for all of our providers out there that are working with our most vulnerable populations, it sounds to me like the easiest way to get those folks vaccinated is to call the Community Health Clinic. And I would encourage you to reach out to Raji to make sure we figure out how to do that as soon as possible. So thank you so much for joining us. And I hope you'll join us again, Raji. Dr. Thomas is usually with us, or Dr. Conway is usually with us from the IU. He got pulled into another meeting, so he won't be with us here today. So we're going to move straight on to Jennifer Miller with the Westmoreland County Food Bank. Jennifer.
Wonderful. Thank you so much, Phil. It's wonderful to hear about all the vaccines that are available, and we're hoping and praying that people will take advantage of them. The food bank is very willing to spread the word to our consumers, and however you see fit, whether it be on our social media, sending out flyers to our food pantries, whatever it takes, we're willing to do. We also have a space here. It's not huge, but it's good for scheduling to have people in. We are willing to offer that space out. For those who don't know, we are located in Delmont, right off of Route 22. So a great place for the in-betweeners between Greensburg and Murraysville. So for the food bank, our numbers are pretty steady. We're between 5,000 and 6,000 families every single month. We have not seen a huge uptick in demand. However, we know it's still out there. We are contributing the flatlining basically to the opportunities that are in the community, which is great. But we will be here for whenever anybody needs us. We'll be celebrating our 40th anniversary next year, so we're in plans to commemorate that in a special way. So our Operation Fresh Express programs have began again. We did cease operations of that program through the pandemic of last year. So fresh fruits and vegetables, as well as perishable food items, are now available throughout the county. Everybody that is invited to the distribution will receive an invitation from their food pantry that they go to. We are doing our best with social distancing. We are doing our best to make sure that everybody is safe. Everybody must wear a mask. All volunteers must wear masks and gloves. We are doing as much pre-packing of that product as possible so that people aren't waiting in lines for an extended period of time. And we are doing drive-throughs where it is appropriate, where it is safe and available. If you've been to any of our Fresh Express distributions, a lot of times that is not a possibility. So we are doing our best to make sure that everybody is safe, but getting the food that they need at the same time. And there's a Fresh Express distribution once a week somewhere in the county. The Summer Food Service Program will be up and running in June, towards the middle of June through the middle of August. We are still looking for sites in areas that are underserved. In other words, that are not, their school areas are not participating in the Summer Food Service Program. So if you have a site that you know that your school is not participating, please give Michelle Heller a call at 724-468-8660, extension 25. We also received an expansion of our senior food box program, also known as the Commodity Supplemental Food Program. We're able to serve 1,400 seniors now. There is not a waiting list at this point, so if you have any seniors that could possibly be eligible, please have them call Michelle at the same number, 724-468-8660, extension 25. And we do offer home delivery for that program as well for seniors who can't get out to food pantries. We have a core of volunteers that are willing to step up to the plate to do that. And we also work with, help me, Alyssa, the senior program, I can't remember the name, I'm horrible.
Open Your Heart? Open Your Heart to Senior?
Open Your Heart to the Senior. Sorry about that. I couldn't find my words. We are working with them as well to have that program, make sure that our seniors are aware that program does exist. It gives a nice variety, a nice dietary quality of food to seniors in need. They do need to be 60 years of age or older. We do have food drives starting up again. Throughout the pandemic, that was really low. So if anybody is interested in doing food drives, we encourage it. And the Scouting for Food drive that was totally canceled last year is coming up on April 17th. So if you have a scout that drops off a flyer or a door hanger or a bag, please, remember your local food bank and drop that off in your in front of your house, and I'm sure that they will pick that up for you and bring it to a central location, and then it's delivered here to the food bank for sorting. So other than that, again, we're here, and if you have a client in need or if you are in need yourself, please do not hesitate to contact the food bank. That's what we're here for, and we're ready to serve. So thank you.
Thank you so much, Jennifer. I really appreciate that. Let's move on to Deb Thakral with Feeding the Spirit. Deb, are you with us?
I am. Can you hear me now?
Loud and clear. Thank you.
Good, good. I think I don't have the video, but I have the audio working. Thank you to everybody for all the work they've been doing in the community, and to echo Jennifer and Bud's, what they talked about with the upcoming COVID vaccines at Seton Hill. We will be distributing flyers at our weekly meal distribution this evening to everyone. Michelle graciously dropped them off to us. And so we usually get between 150 and 250 people that come to our meal distribution every Thursday. So we will make sure everybody is aware of that option. It's very important to us, especially to make sure the underserved get the opportunities to have the vaccine. As far as our meal distributions, it's about status quo. We haven't seen a large uptake. We're finally holding steady at about 200 meals a week. We have not had too many emergency food calls, crisis calls, so that's a good sign, I think. But what we did notice is we ran the numbers of our first quarter statistics for our meal distribution for 2021, and we have served 2,524 meals this first 3 months of 2021, as opposed to last year in 2020, the first quarter, we served 1,085. So a huge difference for a lot of reasons, obviously, and we are aware of that. We're just happy that we can continue to touch people in that way. We'd also like to give a huge thanks to Westmoreland Community Action and the Blackburn Center. They donated a whole bunch of laundry detergent, dish soap, hygiene items, cleaning products, paper products for us to distribute last week. Our folks really need that all the time, but especially in these times. And the laundry soap is like gold. So if anybody has any extras they would like us to distribute on Thursday evenings, please contact us. We would be grateful for that. We have an upcoming event I want to remind everybody about. It's this Saturday, April 10th. It's a Fill a Truck event where if you want to get rid of your clothes, shoes, and handbags, you can put them in a garbage bag and bring them to Z&M Motorcycle Parking Lot. And we will be there with mission partners to fill a big box truck with all of the items you no longer want. And we get paid by the pound. It's a nice day. It's a good way to have the community come together. And we're real happy when the Z&M hosts that for us. So if you need any more information on that, you can go to our Facebook page or our website. That's about all I have right now. So thank you, everyone.
Great, thanks so much, Deb. Appreciate it. Let's hear from Dan Carney, who's going to talk a little bit about the rental assistance program and may have some other things to talk about as well. Dan.
Thanks, appreciate the opportunity to share out a little bit here. I'm going to kind of break this down kind of short, medium, and long term, I guess. Right now, there are still several of our partners that are working and delivering services. As you hear, housing certainly being in need. Blackburn Center, Welcome Home, Feeding the Spirit, they're all still delivering their services and meeting those needs as they arise. The cold weather shelter just wound down here at the end of March, although there is still opportunities for folks that need that assistance if the shelters are full. So please continue to refer to that network for those services. The ERAP program, the Emergency Rental Assistance Program, is probably right now the most critical and important thing going on kind of in the housing world. It will help provide assistance for 12 months, backwards or forwards, for folks with rent and utility assistance. And so we recognize that there is certainly a huge need right now. We will be putting out a flyer and asking that it will be distributed to this group. We'll be sending out flyers via email. The food bank has agreed to distribute flyers in all their food boxes for us to get the word out to people. We've got information already out to the courts, the police departments. We have over about 800 people signed up for our notification and distribution list, so they're getting notified. We're really trying to get the word out. There'll be some radio spots, but so helping spread the word will be really, really important. And spreading the word so folks kind of understand. We've seen some misinformation or things that are confusing, especially for some of our seniors. And so we're trying to help find ways to educate that population specifically that's struggling with utility assistance. This program does require a demonstration of either being on unemployment or having a COVID-19 financial impact. So that can be loss of income, change in work, increased costs, so for childcare, things like that. And we're finding some folks that are reaching out for assistance now that aren't meeting that. So we're really trying to kind of partner with our agencies collaboratively. They will have access to be able to share that information, and we'll make sure we get folks connected. The application process will go live on April 12th. Can be accessed online if you go to the Union Mission website. It's www.theunionmission.org. If you throw a /ERAP on the end of that, it'll take you right to the page. Otherwise, there'll be a box that pops up when you go to the main website. It'll direct folks if they want to access that page. That will go live on the 12th. We are working to finalize the software components and make things really easy for the users. Folks will be able to apply directly doing that all electronically. If they don't have access to technology, we've been building and finalizing our list of partners in the community. We overlaid where we saw the CARES Rent Relief Program participants, the volume of those folks applying, with demographics related to eviction rates in the county, and pockets where the majority of households were living under 50% AMI, to kind of carve out about 18 sites that are locations in the county that we wanted to make sure folks would have access to technology. And a lot of libraries have stepped up to say they will help if someone needs simply to access technology and needs help with scanning and getting things uploaded for that online application. We additionally will have a mobile team that will go out and be able to schedule appointments to meet with folks, or have folks come in and schedule appointments to meet with our team here at our offices. We'll be putting together a pre-paper application for those appointments. So it'll be a simple checklist for them, and to understand what documentation they're going to need to have gathered up. And when they can have all that ready to go and demonstrate that, we'll set that appointment for them to actually come out and do the application for them and with them and handhold them through that process. There are priorities for folks that are, so we'll be prioritizing the under 50% AMI populations, those that have been unemployed for the last 90 days or more, and those who have an eviction notice currently will be prioritized within the software and given points so we can service them first. So if you're hearing from folks who may be asking questions that are in that 75% AMI, though they're eligible, they will stay until we can get through those more critical populations first. So it's a lot of good things. We're really excited about it. There's a second wave of funding under the American Rescue Plan that will also tie into this program. So we anticipate that it'll be able to go forward. And there's some speculation at this point, so I won't, in terms of whether folks will be eligible for round 1 and round 2, or if they're going to consider them one program. And so I don't want to mislead. Long term, there is a group of folks that have been meeting. Some of the people on the phone call may have been familiar with what was called the LHOT, or the Local Housing Options Team, or the Westmoreland Coalition on Housing, which has become a distant ghost in the past. Those that we still hear whispers, but they're long gone. And there's been a core group of leaders, stakeholders, and interested community members around housing issues that have been meeting for about the last 18 months, focused on rebranding and relaunching the work around creating safe, affordable, and a sustained place for every member of our county to call home. And we're really excited that group has brought some new energy and some new focus for the future direction of housing. And as it was mentioned earlier with Alyssa and the Human Services Study, this idea of aligning and bringing together the force and the impact of everybody kind of working towards the same goals is really important. So we've had a lot of discussion around intentionality. How do we move forward and actually create growth and impact? We are submitted and we'll be submitting a grant request to bring some financial resources to help strengthen that work. And so we hope to actually have a part-time staff person and some consultants to really walk us through over this next year those critical components that we need and build the foundation to where we can strengthen the work around housing and homelessness in this county. I say that to also say, if you're interested, we are creating, there are 4 teams that operate or will operate under that program. Just shoot me an email and we'll get you on the list, and we'll plug you in when it's time and we're ready. So if you have an interest, we certainly want to have your voice included in those conversations. If anybody has any questions about ERAP or anything else, email me, call me. We will, we'll, get that sorted out. We're mad dash. We have a 5-hour meeting today to get some of the software finalized and get everything ready to go. But we will answer your questions and get you everything you need. That's it for me.
Awesome. Thank you so much. I appreciate that. Dan, is there a name to the new group? If it's not El Hot and it's not, is there a name that you all have for the new housing group?
Yeah, thanks, Phil. I appreciate that. It's called WHAT? Westmoreland Housing Alliance Team. So we're kind of like, what, right? Like it's
Perfect.
What? So yeah, we appreciate that. I apologize I missed the name. Thanks, Phil.
Awesome. Thank you so much. I want to make a quick note before we move on to Jesse from United Way. Quick note that in the handouts section, we added the handout for the Seton Hill COVID vaccine distribution. So if you want to go ahead and check that out in the handout section, that way the flyer that Deb was talking about, you can grab it there. And thanks so much to Bud and his team for creating that flyer and sending it over to me so I can get that uploaded. Without further ado, though, let's go ahead and move on to Jesse Spraker, who's here from the United Way to talk to us about summer fun and learning and all sorts of things with children. Jesse, go for it.
Thanks, Phil. Yeah, I just wanted to go through real quick a program that we're launching right now. It's come together very quickly, so I don't have links or anything like that yet, but I would like to let everyone know. In collaboration between us and the Pittsburgh Foundation, thank you, Phil, and several other of local foundations, we are launching what we are calling pretty much the Summer Fun Project for this upcoming summer. Welcome back 2021. So we will be launching a request tomorrow morning, hopefully, for anyone who is offering summer programming pre-K through 12th grade. You must be a 501c3, have to be in Allegheny, Armstrong, Butler, Fayette, or Westmoreland counties, operating in person only June through August 21st or 2021. We're, as always, as United Way, strongly encouraging partnerships between organizations for anyone who's working with that population of student. It must be in person from pre-K to 12th grade, as I mentioned. The focus areas will be on geographic diversity throughout the region, providing support to communities with limited summer resources. So that would include communities that may not have summer programs running, or getting kids to and from those to other programs outside of their community to make sure all of our kids have the opportunity for good summer programming. We will also be focused on restarting programs in person that may not have run last year. So if you took the summer off last year because of the pandemic and you're having trouble getting up and running, that will also be a focus for this upcoming summer. We are also focused on smaller community-based providers that are specifically in neighborhoods of needs. So keep that in mind as well. And then finally, the last focus will be on larger providers that are trying to expand services to new locations. We've had many conversations with providers all throughout our region, and trying to get access when they may not have access to schools like they normally do has been a challenge. So thinking outside the box on those. You can see my name there. If you have any questions tomorrow and you don't receive the request, please email me. I will say there's one quick note, Phil. It's jesse.spragar@unitedwayswpa.org. So if you do not receive an email from our office tomorrow and you fit that criteria, please reach out via email. I will get back to you quickly with the link, and we'll get things moving and hopefully help our kiddos moving into next school year. Thanks, Phil.
Awesome. Thanks, Jesse. As many of you may have noticed, Allison Wolmer, our administrative assistant, is not with us today. And so clearly you've now found the mistake that I've made in Allison's absence. But feel free to reach out to Jesse, though, just to underscore, super important to get those kids engaged over the summer to prevent not only summer learning loss, but to think about all of the loss in education opportunities they've had over the last year. So really great to see the foundation community rallying behind that to get those kids engaged. So once again, if you don't receive the RFP tomorrow, if you don't see it, please reach out to Jesse. You can also reach out to me or to Alyssa. I'm sure we can get you the information as soon as possible. But once again, I want to take a moment to thank everyone for their time. We've done it in under an hour once again, which is amazing. So much information in under an hour and really critical information. Before we log off, Alyssa, do you have anything else from United Way that sort of popped in your mind as my co-host, partner in crime?
Nope, I think we're all good. That was a lot of great information, and yeah, I'm just so excited that these calls are so productive for everybody. And we really see the widespread opportunities for people in Westmoreland and actually other counties too. So thanks.
Awesome, sounds good. As you can see, the next upcoming call is on Thursday, May 13th at 8 a.m. I'm excited that next month we'll be joined by the new Executive Director of the Community Foundation of Westmoreland County, McCrae Martino. She actually starts on Monday, and so glad that she'll be with us for the May call, and I look forward to having her connect with all of you as she joins us in our response to the pandemic. Thanks so much, and we'll see you next time. Bye.
Thank you.